Desiree, thank you so much for being on the podcast today.
Thank you for having me.
So I like to start every interview by asking guests, as a kid, what did you want to be when you grew up?
I have to give you the psychologist answer to that because I think that my answer to that, which is sad and says a lot about me as a child, really changed with whoever my audience was, right? So as a young kid, before I was super in tune with audience, I would have told you I'm like a ballerina or an ice skater, even though I had never really tried or sampled any of those things. But as I got older, I started to tell people these things that I wanted to be that I thought they would think was a sign that I was really smart. So I went through a whole stage, probably up until high school, where I would tell people that I wanted to be a pediatric oncologist. So yeah. And I think I kind of believed it at the time, but it was also kind of I want this person to think I'm on the right track or the right path. So let me say
Not just a
something that sounds like
pediatrician, but a pediatric oncologist, that there
that.
had to be
Yes.
some knowledge there.
Yeah, and an added layer of specialty was what my sixth grade brain was gravitating towards. So,
And how do you think that connects to what you do today? And would you share with the audience what you do today?
yeah, so I am a clinical health psychologist. So I support people, for the most part, I do see people outside of this realm, but I support a lot of people who are navigating a serious illness, such as cancer or something that's really chronic and difficult, like a rare disease or like rheumatoid arthritis, pain conditions, really significant illness that just impacts everybody's day to day. I've been doing that for a while and just recently transitioned into private practice and kind of am doing that work in another setting now. The way that I would relate that thing that I had to share with people is that it is in the medical field and it is a helping profession. And so there's definite connection to that. And I think that that was probably what I was trying to get at that time, and maybe didn't have enough knowledge about the ways that I could do something within medicine, the ways I could do something within helping. And that was just a label at the time that kind of fit that.
Yeah. So tell us about so you were in sixth grade, you were thinking about,
Yeah.
something helping
Uh-huh.
wise. But did you follow that all the way through? Did you know in college that this is what you wanted to do? Like, walk us through
Yeah.
kind of journey to
Yeah.
the role you're in today.
Sure. So a little background, I am half black, half white. And so my dad, as a young kid growing up, he is African American. So he was really big on messaging to my sister and I about you need to be able to take care of yourself. This world sees you as a black woman and is not necessarily out here to support you. So choose a profession where you will be able to financially be independent regardless of what happens to you. And so that was something that was always really influential to me in terms of making decisions. So I always gravitated towards things where I had this perceived sense of hey, I'm going to be okay. I can support myself in this realm, which is one of the reasons why medicine came up. And my sister went to medical school. And so I watched her go through medical school. I went through high school thinking I was going to go to medical school. I started college as a pre-med student at University of Texas. I was actually an ethnic studies major, but pre-med focused. So my area of specialization was in African American studies, but I did all the pre-med courses. So I went through the whole thing. I took genetics, I took organic chemistry, did really well at all those things. And up until my junior year, I was on that track, kind of knew in my gut the whole time, hey, this is not the direction that you're supposed to go in, but continued to pursue it because it's kind of what I thought I was going to do. And was something that when I shared it with my dad and with my parents, they were really supportive because they could see that there was going to be a good outcome where I could be independent in that realm. So long story short, watched my sister go through med school, watched her start residency. And I was like, ooh, that looks really hard. And not only does it look hard, but the people who are choosing to go into that path, they don't really seem like me. They're not quite like me in the things that they're interested in. So my junior year of college, I started to kind of tap into that and think about it. And I actually got a therapist at that time and started talking with her about it. Yeah. And eventually, after a lot of struggle, it wasn't just a quick shift, but I decided to do something different. And I stuck with my major, but I decided that I wanted to start exploring psychology. So I started taking psychology classes and got enrolled in a psychology lab and met some great mentors at the University of Texas, took some great classes on the psychology of women, the psychology of race, and just decided, hey, I'm going to get my PhD in psychology, told my dad, and he was like, what are you doing? This is a huge mistake. And he
Even though
was
you were
legit.
saying a PhD.
Yeah, he was like, he didn't, as a person who didn't necessarily go to college, he didn't have like a frame of reference
Mm,
for the way in which that would be financially supportive for me. So he was
mm,
fearful of that. I think he was pretty mad at me for making that decision, probably up until I got my first job. Like, I think he didn't think it was the right decision for me. So yeah, I pivoted and started applying did all the things that one would need to do to get into grad school. Had to kind of like take a step back and add some things in, and applied to grad school, and luckily got into school at the place where I was attending undergraduate. And so that started the graduate school journey. So
mm. Well, I want to highlight that it must have taken a lot of courage to kind of tell your dad, I know you think that I should be a doctor and my sister's going to be a doctor, but
mhm,
I want to take this other route.
mhm,
What was
mhm.
that like?
I can literally describe to you the exact day, the
Mm,
way that the room felt. It was traumatizing. Like, it's ingrained in my brain
mm,
as a traumatizing experience. So I actually did it with my therapist. So
yeah.
she facilitated a conversation over the phone with my dad. She was in the room, and, I realized that not everybody is going to broach conversations like that, but that's how serious the combo was. So you're
Wow.
right. It was
Wow.
it was vulnerable. It took courage, and his response wasn't necessarily one of like, pursue your dreams, I know, be led by your interests. It was not that at all. So it continued to require courage after sharing that. Like, it
Mm,
continued to require courage to pursue those things. So
wow.
yeah.
And even reaching out to your therapist, I think, as the first person in my family to go to college,
Mhm.
I had no knowledge of therapy that it was even offered in, during
Yeah.
university. And
Yeah.
then even if I think towards the end, I knew about it and I knew it's something I could take advantage of, but I never actually went out and searched it out. So how
Yeah.
did that come about for you?
It came about, I was experiencing basically perfectionism gone extreme in college, and it was really getting in my way. And my family, my mom was really helpful in helping me to find a therapist. So she was really the person who kind of like led that. And then I took an interest in it and just kind of kept it going. And I worked with that therapist for, I think, maybe like almost like 6 or 7 years, maybe even a little
Wow.
bit more. Yeah.
Wow.
So at the time, I didn't see what I needed in myself. It was a family member who really helped me to get connected to what I needed to get connected to. And that was a huge part of me just like pivoting and pursuing different things in my life. So it was a big deal. And my being a biracial person, my dad wasn't necessarily like a therapy supporter, right? But my mom, is a white woman who did have some experience in college, that was more something that she connected
Right.
with more and had more experience with. So she was directive in that way.
Mm. And so were
Yeah.
you sitting in therapy thinking, maybe one day I'd like to do this?
I think at that, here's what's really funny. My therapist, she had like this really cool office with really cool art, and she dressed in all anthropology clothes, and
Oh,
she
she
just
was
had like a,
cool.
yeah, she had like a really cool vibe. And I was like, oh wait, there's a profession that you could go into within mental health where like you can be in a cool environment and have cool clothes and be a helper
Yeah.
and be in medicine. And so yeah, like pretty much as soon as I saw her and saw that space, through those interactions, I could kind of see myself in it. But it was very much based on like the look of things at first, as opposed to like the nature of the work. So
Yeah. Well,
mhm.
and then so walk us through to today, like, or I guess maybe going back, how did you know that it was health issues that you wanted to focus on? How did that come about?
Yeah, it was a slow progression. So in school, they start off your first year in the program that I went to, you don't do any clinical work. And then in your second, third, fourth, and fifth year, you have to apply to various clinical sites. And so pretty much by I would say the third year that I was there, I just kind of happened into being in a primary care clinic as a therapist and as a therapist in training. And I loved it. So within primary care, and this was in Austin, what I learned is that minorities, people of color, aren't necessarily in spaces or come from backgrounds or have access to just go engage a therapist. And so people of color, as well as people in general, go to primary care, go to their primary care provider, and oftentimes are talking about anxiety, depression, stress. And so I took an interest in medical settings because I felt like it was accessible to people and accessible to people of color, which felt really important to me. And then through being in those settings, just started to learn more about, like, people present with health related issues, but a lot of times these health related issues are related to what's going on in their family or related to what's going on with them from a mental health perspective. So over time, the health piece was really a way to connect with a broader group of people, if that makes sense, and people of color. And then it just got more specific over time. So after primary care, then I kind of ventured into oncology spaces and sleep disorder clinics, then started to have an interest in working with multiple disciplines and not just serving the patient in isolation, but being able to work with their oncologist, their
Mm.
radiologist, their surgeon, and being able to like provide cohesive and collaborative care to folks became really important. So I think that's one of the reasons why I kind of stayed in that field, was just like the broad care that you could provide to somebody that really appealed to me.
Wow. So you would work with, so like the radiologist, like what was that conversation like? You would just kind of get an understanding of like the whole, like what was going on with the person from all doctors involved.
Yeah. So
Mm.
basically, when you're embedded within a medical system, if it's a good medical system, you can have access to all of their medical notes, right? So what would happen in my experience, like let's say my last hospital that I worked at, somebody would go to their oncologist, they would get a cancer diagnosis, and they would also report having significant anxiety or a significant sleep issue. And so that oncologist is like trying to manage their chemotherapy and that regimen, and there's not necessarily like within their scope the ability to help them thoroughly with the anxiety and with the sleep. And so they would reach out to us as psychologists to help manage that piece, which is huge because anxiety is a major factor in you exercising and moving, eating the ways that you need to eat, getting to sleep, which is a huge part of how people get through their course of care and their course of
Wow.
treatment.
Yeah.
So yeah, and it would happen in a lot of different ways. Oncologists send referrals directly to you. You go to these big meetings called tumor board meetings. They present cases. They tell you this person needs psychological intervention. They call you on the phone. I need you to see this patient. Here's why. And sometimes they call and ask for a consult. Like, here's what I'm experiencing with this patient. What would be the best way to work with them? They may not even ever come and see us in the psychology office, but we would provide consultation to the providers as far as like how to work with a patient who is presenting with certain complexities from a psychological perspective. So
Wow. That's so
yeah,
important and so needed.
yeah, it is. And the other thing about cancer, and many cancer patients or individuals who are navigating cancer will tell you this, but it is such an emotional
Mm.
process. It's not just a physical process. And
Wow.
that part of the care is not always like built into programs, but people need it. Like they need to be able to process those things, and especially when treatment is done. That's when like their stress response has kind of calmed down and they're not just, moving in shock mode anymore, and they start to kind of like come to
Mm.
with the experience that they've had and the ways in which their life is really different, and they need support through that, and they deserve it. So
Wow, that's fascinating because I would have thought it was most needed during the process and maybe not necessarily. Yeah, I mean, it's always important. I believe it's always important,
yeah,
but I would have thought it was critical during the process. So it's
yeah.
fascinating that,
Mhm.
after it's so needed as well. And that makes sense.
Yeah, yeah, and the hard part is that a lot of people don't, like, they think about that similarly to you, like, as they start it, they're like, "Okay, when this radiation treatment is done and I'm at the end of my course of care, then it's all gonna be over." So it's like the
Yeah.
double whammy of, I
Mm.
thought it was gonna be over, and then this emotional wave starts around that time, and it's very unique and different than, and it's isolating because not everybody understands that. People move on. They're like, "You're done with your care. You survived it.
Mm.
You're."
Mm.
People call it NED, no evidence of disease, and so family
Uh,
steps back, support steps back. You don't have a doctor that you're seeing all the time, so you don't have a place to process that stuff. So it gets hard.
wow. And I think about like just people in my family or people that I'm close to that have gone through health issues. I guess for someone listening who maybe knows someone in their life or is going through something
Mhm.
health wise, do you mind kind of talking about the importance of seeking out help? Because I first started working with a therapist who you recommended, actually, thank
Mhm,
you, last year. And it's been incredibly helpful for me. And I wasn't
mhm,
necessarily, there wasn't like an event that caused me
mhm,
to go. It was just kind of like, I think this would be good for me.
mhm,
And it has been, it's been wonderful. And so now I
mhm.
believe everyone should have a therapist.
Yeah,
What do you see? One, in general, why people
yeah,
should seek out therapy. But then, and then second, when going through something like a cancer diagnosis,
yeah.
something really big in their life.
Yeah. So the first thing I would say is that, if we're fortunate, we do have good family around us and good support. But sometimes the kind of support that your family can offer is made very difficult by the fact that they too are usually experiencing that chronic illness
Mm,
right with you. So
mm,
let's say you have a stage 4 cancer, and it's hard to get the support that you fully need sometimes from your partner because they're also processing that grief and
mm.
that anticipated loss and the changes that kind of come with that.
Wow. Yep.
So they are people that are needing help and support and can't always like fully meet your needs because there's so much that they're carrying.
They have
So
their own probably.
yeah, yeah. And I think that's something that people, I wouldn't say that they forget, but people don't sometimes account for when
Mm,
they're like navigating that piece. So I think that family in the situation of chronic illness can be supportive and can be an amazing support. But sometimes the kind of support that they offer and the places that they can go in their worlds are very much compromised by the fact that they're experiencing this right alongside with you. So that's probably number one why it's helpful sometimes to get support externally. Also, just not to toot anybody's horn, but there's some cancers where the management of stress, changing in how you eat and how you sleep and how you move changes your experience of
mm.
that disease process. It may not necessarily completely and totally change the outcome, but it can change your experience. And then doing those things, changing your health behaviors, that's really hard. Like a lot of us have, I think Brene Brown talks a lot about like integration. Like we have the knowledge in our head, but we can't
Mm.
push the knowledge into our hands and make change. And so
Yep.
you need somebody who's going to facilitate that process, which a therapist or a psychologist can usually help with those behaviors that one sometimes help to change the likelihood of you having a recurrence, sometimes change the experience of the illness itself. And then also for people who may not have a change in illness, it impacts their quality of life. Like if they're moving, they're eating well, they may have more energy, which allows them to more deeply connect and pursue meaningful change in their life, like pursuing a career change. And on another note, with illness and especially with cancer, your whole life flashes before your eyes.
Mm.
And a lot of times people come out of that knowing in their body that it's time to make a change with their career, with their
Mm.
relationships, with how they pursue parenting, and with how they want to be with their spouse. And those are really big things to change because we've been living in a very consistent pattern way in those spaces. And getting support with that change is sometimes the only way to really start that change and be accountable to it. And I think that that does come sometimes with illness and does come sometimes with serious diseases, is that kind
Wow.
of like life flashing before your eyes. I want to do things differently.
Wow. Yeah,
So
those are a
yeah.
lot of pieces that I hadn't ever really considered. And it's interesting and so helpful. I think it'll give people who either are going through something or know of someone. I think we all have someone we know who might be experiencing something, and to kind of think about those different pieces. I can imagine that going through something really hard and life flashing before our eyes
Yeah.
could be the motivating factor to want to change, but then not having the tools, not having the
Yeah.
support, that would be really
Yep.
difficult.
Yeah. Definitely. It's a weird place to be if you don't have that in your pocket, your back pocket. So
Yeah.
yeah.
So if someone's thinking about, I think I might be ready to reach out to a therapist, and maybe even not necessarily because of a health issue, but just in general, what
Yeah.
would you say to that person? How should they go about it? Because I think now I'm always kind of advocating for it, telling people, you should get a
Yeah.
therapist, you should get a therapist. What would you say? What advice would you give them? Because I always tell people maybe the first person is not going to be the right person for you. You may not
Yeah.
click. And so just keep trying. But I'd love to hear your perspective on that.
So I think it's hard. Mental health is a weird world out there. Like there's a lot of stuff to decode within it. There are various different kinds of providers. You can see a licensed clinical social worker, a
Mm,
licensed professional counselor, a sex therapist, a psychologist, a
mhm,
psychiatrist. And so it's If you've never experienced it before, it's difficult to like know where you should go.
And there's different
But
types of therapy too, right? Like
yeah,
the
yeah.
type, I don't even know all of them, but like there's different types. So some therapists say specialize in one type over another.
Right, right. There's different modalities and ways that people provide care. And then there's also variation within the degree that people actually stick to that. Like sometimes people are like, I do this. And then when you get started with them, that's not really what they do. So it's a difficult world. But I think that it's if you have a support network where people have done therapy before, it's nice to kind of start
Mm,
within that realm and to ask
mm,
for recommendations within that space. And then really having a good sense of what it is that you kind of want to work on and what you don't want to work on so that you can ask questions of that person. If you find somebody that is of interest, hopefully you'll be able to have like an initial kind of encounter with them where you get to ask questions about what they do, how they do it, how long they typically work with people, how they support that person in measuring change or measuring success. Those are good questions to ask. I also think that there's a lot of resources out there and websites. Psychology Today is a place that you can go and search for providers. But here's my warning for people: when you see that a provider has listed everything in the whole world under the sun that they are capable of treating and
mm,
doing, that
mm.
is sometimes a warning sign that,
Interesting.
yeah, I would say trying to find somebody who more so specializes in what it is that you're wanting to work on is important. And when they say that they can do all the things, that's not true because no one can do all the things. You can't really
Mm,
be good at all the things. So that's something to watch out for. And then knowing if you get started in therapy that the first couple of sessions are about like making sure it's a good fit for you. Sometimes there's some financial costs associated with that, but you don't just start and then you're bound to that person for forever. You have to
mm.
constantly be thinking about like, is this working for me? Does this feel like the right fit as you're beginning? And if it doesn't, pivoting and feeling okay with that.
And how would people know if it's the right fit for them? Like I know with my therapist and even with my coaches that I've worked with, I tell people
Yeah.
like I had a sense like I felt safe. I felt
Yeah.
like I could trust her. It was important for me to have a coach and a therapist who was a woman. That
Yeah.
was just something just for me personally that I wanted. I had to click and not feel judged and not feel like somebody was condescending or that kind of energy.
Right.
So how what would you tell the person who's trying to find what do you look for? How do you
Yeah.
know?
Well, I that's a big question. I think if somebody has a presenting issue, I know that when you, as you mentioned earlier, when you started, you were looking to explore things in a really broad way.
Yep.
But for some people, they have OCD and they need to be
Mm,
working with somebody who
right.
has
Oh, gotcha.
evidence of like sufficient training and experience in treating those disorders. And you want to ask those questions like, what kinds of training?
Mm,
Where did you get that training? What's your approach if you're navigating something that is specific like that? I think that that
gotcha.
is very important. But yeah,
Mm,
the fit of safety, I think, is a big word. I think for some people of color, sometimes finding a person of color who also has background in training and understanding the experiences that people of color have or that
mhm,
LGBTQ population has
mhm.
is a space where they would feel most safe. Being able to just to work towards being your authentic self in that space, I think is important. But yeah, for the most part, I just tell people like, is this a place where you feel like you are comfortable and you are connecting? You may not be totally connected just yet because it takes time, but comfort, safety, the beginning seeds of connection are all important things to kind of think through. Now, the hard part about that as a therapist is like sometimes we bring personal variables to situations that can affect whether or not we connect with people or feel safe with people because of our backgrounds. Like we may have issues with being open and being vulnerable. And
Mm,
so it may be hard in those first couple of sessions to feel those things because of your unique history and your unique background. But if after several sessions you're not feeling connected in some small way and you don't see the seeds of that, it might be important to consider exploring someone else, if that makes sense.
yeah. I connected right away with my therapist and
Uh-huh.
I love working with her. So I feel like people should not just feel like, oh, my therapist is okay. She's
Mhm.
fine. There should be something a little bit, maybe after not right away, there should be this feeling of like a deeper connection, even though it's just kind of one sided. I feel really connected to my therapist.
I think that what you're saying is also a reflection of you taking stock of something that's also really important to you.
Mhm.
But I think my psychologist had us thinking about
Oh,
people
this is
like,
good. Yes,
let's,
tell me.
yeah, like let's maybe somebody has attachment issues, right? And
Mm,
so they're presenting to therapy because they have a difficult time connecting to people. And so if they
mm,
only use that as a metric for like what was going on in therapy, it would be very much obscured by the fact that this is like their issue. You know what I
uh,
mean? So I
yeah.
think that like taking stock too of like what your personal challenges are and maybe
Mm,
understanding like starting, and this is something that your therapist maybe will help you to explore, but maybe understanding like the ways in which that could potentially affect your initial connection and what therapy might even feel like is really important in the beginning. Otherwise, you might have some expectations for the experience that are being influenced by like what you're bringing to the table, what your history is bringing to the table. So like a lot of my I would say that in the past I've worked with people of color who have like a lot of mistrust around working with healthcare providers or like mistrust in general of being able to difficulty connecting because they don't trust that people are going to like hold their pain in a way that feels compassionate because of their history. So they're kind of like on edge the first couple of times and like not connecting because they're fearful of those things. And that may not be because I'm not the right therapist, but it could be a part of their trauma background and
oh,
their experiences of navigating healthcare and working with people. So
mm,
it's hard because it's like you're thinking about like, am I connecting to this person? But also, what am I bringing to the table that might be influencing this? And so it's
mm.
a process of reflecting on all of that, which is hard and most people aren't thinking about in the beginning because that's
Yeah,
why
because
they're
they
getting
don't
into
know.
therapy in the first place, right?
They don't know that yeah, that's so
Yeah,
interesting. Wow.
yeah.
Wow, thank you for that. So, if someone is feeling like, okay, maybe I'll try it, what are the benefits that you've seen? What are maybe, I know you can't share stories, but like going through this process,
Yeah,
opening
yeah,
ourselves up to a stranger and
yeah.
being really vulnerable and even during something that's really difficult, like a health issue,
Mhm,
cancer,
mhm.
what are the benefits
Um,
there?
I mean, like in a really general way, I would just say that like there is nothing in my experience of being a human in this world, there is nothing more powerful than like feeling that you are seen and heard. There is something about that like it's more than just like, ooh, this was a good experience. It like touches your soul when somebody really sees you and
Yeah.
when somebody really
Yeah.
hears you. And that is like one of the richest places to move from when you're taking on big things. Does that make
Mm,
sense?
yeah.
I always tell people this is maybe like not the most powerful experience in being seen and heard, but when I was a little girl, and this is a true story, and I hope my parents don't listen to this, but when I was learning how to ride a bike, we lived in Michigan and it's really cold outside. And like it could be a wonderful place to learn how to do things outdoor, but it could be also awful. So my course of learning how to ride a bike was like in the cold. And so when I would go with my dad and I would fall off the bike and something bad would happen, he'd be like, "Get back up, Desiree, you got this." Like he was like minimizing the pain that I had just experienced, right? And so I was like getting back on the bike, but with just like resentment. And then I didn't want to pursue this new thing or like
Mm.
learn this new thing or do this new thing because I didn't feel supported. And then on the flip side, with my mom, bless her heart, when I would fall off the bike, she was like, absolutely, you do not, basically, like, you don't even need to learn how to ride a bike. Don't go do hard things because hard things are painful. Like, let's just
Oh,
go inside and bake
yeah.
brownies so I don't have to watch you bang yourself up and we both go through this unpleasant thing, right? Which meant that in that difficult situation, being around her, being with her through that difficult situation, I was kind of backing away from the hard thing.
Mm.
And then with my
Mhm.
sister, she was really different. And this is a true story, like when I would fall off the bike, she would come to me and she would literally say, like, man, that spill that you just took was a rough one. And like didn't look cute at all. And you were all scratched up and hurting. I'm really sorry that that happened. It was hard to watch you go through that. And also, when you're feeling ready, maybe we can get back on the bike and you can try these things and do these things differently. And I think about this more as an adult. I didn't really know this as a kid, but like that was the instance where I got back on the bike and I tried something again, right? That was when I most wanted to make change, do better, try harder, experiment, think through what was happening, was when I was seen, when I was heard, when somebody like acknowledged the difficulty, that's what prepared me then to like get back out there and do hard things. And I kind of think about that in the context of therapy. It's like this space that you're being seen, you're being heard if it's a good space. And that allows you to get back out and do hard things because of that. And then what you're specifically working on in that specific area, it just kind of propels you into that sometimes. So that's how I think
Wow.
of therapy. It's not always like that. And sometimes with patients, I've helped them, and my patients will tell you this, I've helped them in one area and I'm not equipped to help them in another area. It's for me personally, my skill set does not span into all the things. And so I might be able to do that in one area and not in another area. And it becomes important for us to think about other people, other modalities for them to start doing that hard change in other spaces.
Mm.
So
Thank you for sharing that
yeah,
story. I once heard on a podcast that when someone shares a story, it's like they're inviting us in to be a part of that memory and to kind of
yeah,
like be a part of it and witness it. And so that was really
yeah.
beautiful. How much older is your sister? Just curious.
She's a lot older than me. So she's 7 years older, and she's an emergency medicine physician, and she's a dean at a local medical school. So
Mm,
yeah, she definitely chose a job where she's helping people through crisis, and she's also
mm,
a helper. But yeah, that
mm.
is an interesting memory that I have, and I'm glad to be able to share that with you. It's a good like reminder for me about what I need in terms of help in the world to be at my
Mm,
best.
mm.
So
Yeah, because you had two extremes with your parents, right? And then
yeah,
she was kind of like that balance and so emotionally
yeah.
aware too. Like, so
Yeah, yeah. She's not like that in every category throughout our childhood, but
if you're
that was
listening.
yeah, but that was one area and one experience where, I can kinda owe my bike riding skills to her, so
That's
mhm, mm.
beautiful. Well, if someone's thinking about a therapy, maybe they're going through a health crisis or health issues, how could they work with you? How can people learn more about you? How can
Yeah,
people follow
yeah.
along?
So I am in a place right now where I'm getting all of my websites put together and
Yeah.
all of my ways to engage me. But the best way to contact me right now is through email. And I'm happy to share that with you if it's a good space to do that. In the future, my website will be a space for all of that. And my social media account as well will be a space for all of that. But right now, email is the hub.
Okay. Would you like to share that email or?
Sure, sure,
Yeah.
absolutely.
Yeah.
It is Dr. Desiree Taylor at gmail.com. And so Dr. Dr. Desiree Taylor at gmail.com. And I'm really responsive to email. So, yep, that's a great place to reach out, to connect. The way I usually approach those kinds of things is I schedule an initial consult with folks for about
Mm,
sometimes 15 to 25 minutes
mm,
to get a sense of what their issues are. And if it's a good fit, then I'll say, hey, I think you're a good fit. Let me tell you more about kind of what I do and fees and things like that. And if you're wanting to, we can establish and set up an intake. Sometimes it's not a good fit and somebody needs a higher level of care. And to the best of my ability, I'll try to get them connected with another person or another space where they can explore other options too. Because, like I told you earlier, finding a mental health provider can sometimes be difficult. And it's nice to like have someone be a guide in that space to help get you going.
mm.
So,
This was
mhm.
wonderful. Thank you so much, Desiree. I think it's going to be really helpful for many people.
Good, good. I'm glad. Thank you for letting me take part in this and have a conversation with you. It feels really good to talk
Yeah.
about these things. So
Thank you.